Hello, everyone, and welcome to another Catching Up on the Couch. I am your host, Christine Madelon, and once again, I am joined by matriarch of the practice, Dr. Angela Stupi.
How do you do?
Welcome, Dr. Stupi, to the couch.
My pleasure.
Today, we are going to discuss what is known in the office as a wellness infusion, but it may be better known as a Myers cocktail. It's another ancillary service that we provide here in the office. So, Dr. Stupi, tell me about the history of the Myers cocktail.
The Myers cocktail was devised by a physician in Baltimore whose name was John Myers, and he passed away in 1984, but this concoction has since lived on and has had certain changes added or subtracted. He infused this for about 25 years or more to his patients, so that probably goes back into the 60s. And the patients benefited by having more energy, increased wellness, a feeling of well-being, and it was used in many different instances for hopes of having the patients feel better.
Okay. So, Dr. Stupi, tell me about the ingredients in this cocktail.
Primarily, the cocktail is made up of vitamins and nutrients. The vitamins include B-complex vitamins that include thiamine, riboflavin, vitamin B12, and pyridoxine, which is vitamin B6. And the other components are magnesium and calcium, and some centers will even infuse glutathione or zinc. The other big component is vitamin C, in which probably about 2,000 to 2,500 milligrams of vitamin C is infused. And the beauty of this is that it is taken up immediately because it's given in the blood. And it does not have to go through the stomach and pass digestion and be absorbed. And some patients are poor absorbers to begin with. But it's interesting, when Dr. Myers did this in the 80s, he would put these ingredients in a 10 cc syringe. That's this much. And he would mix it with sterile water, go to the patient's vein, and slowly infuse it.
Okay. What types of conditions is this good for?
Well, we've found that it can help fatigue. It can help fibromyalgia. Many disorders of lower immunity. Some cardiovascular disorders. It's been helpful for migraines and for asthma attacks. It's a very wide range. Even depression, it's been suggested that it's been successful for as well. And it may take more than one infusion before you see a benefit. And some centers early on were infusing it possibly even twice a week. Took possibly up to 4 infusions before the patients noted the benefit. But once they noted the benefit, they did not have to return all that frequently.
And how about after a severe illness?
Oh, so that would be a great time to give this infusion, because the body is at a low point, and the rapid absorption helps with the restoration of energy and well-being. Just an anecdotal comment on my behalf: I had COVID in October of 2021. And it was the Delta variant, which was a more serious one. And I was quite sick, and I was out for 2 weeks. And when I came back, I was told that I really didn't look good, and I felt terrible. And I decided, after speaking with our nutritionist, that possibly the Myers cocktail would give me some benefit. I came back to work on Monday. I had the Myers cocktail on Wednesday. And within 3 hours, I started to notice a boost in my energy. My appetite started to return. And the following day, I was not awakening with the dizziness that I had been experiencing following the recovery of COVID. I was very amazed. I had never tried the Myers cocktail before, but now I understand what my patients are saying.
Okay. And those benefits are your personal experience.
That was my personal experience. I'm not going to say that every post-COVID patient is going to have a rapid restoration of their health. It sometimes takes more than one infusion.
Okay. Any side effects?
Well, the side effects, it's a needle stick because we're putting an IV in the arm. What goes with a needle stick? You could introduce infection, or you could have an injection site irritation, but that goes with any IV. But with this, the side effects might include some dizziness or a drop in blood pressure because magnesium is a big component of this. And it's like our patients who have preeclampsia and they go to the emergency room and magnesium is administered to bring down the blood pressure in these ladies who have preeclampsia. It can bring down the blood pressure, and so we have to be careful about how rapidly we infuse it. And if the patient's blood pressure does seem to drop, we stop the infusion and wait till it's restored and slow it down. That's pretty much about it. They might get some muscle cramps. That's very rare. Normally, it's given for muscle cramps and muscle spasms and is very helpful in that regard.
So how long does this infusion take, since we're running it at a slow rate?
I think you can figure about 45 minutes till the patient comes in, has the IV inserted. The infusion itself may take 20 to 30 minutes, and then normally the patients can pick up and go about their business after that. They can drive themselves. There's, no problems usually.
Okay. So there are wellness spas all popping up around the area. We've been doing these in our office for at least 3 to 4 years. They're obtained from a special compounding pharmacy. And what that means is it's a hooded method. So it's not someone just trying to make a cake and taking a teaspoon of this and a teaspoon of that.
The important thing is, yes, there's a quick half-life with these. And so if this is going to be done, we have to order it the day before. It is delivered the day of, and then the infusion is given because it has a short half-life. The short half-life. It will not have the boost or the full 100% availability unless we infuse it within 24 to 36 hours.
Okay. So we've looked around and we've seen the average cost in our area. These spas are charging between $300 and $600. And it could be for a number of reasons. They may want extra vitamins put into the compound, which we have done for some of our patients. That raises the cost a little bit. And again, we try to pass the best savings on to you. Normally, our office charges $210 for this service. But during the month of March, we're going to be offering a special on the cocktail for $190. We have patients that come in regularly for it. Generally, we say once a month is sufficient. You may feel that you need it more often.
Well, like I said, if patients are having problems with asthma or with a migraine, recurring migraine, sometimes a greater frequency and sooner is needed. Many times people do it to boost their immune system, and sometimes that will last for 3 or 4 months. Typically, though, patients tend to request it on a monthly basis, and that's pretty much what we've been doing.
Okay. Anything in closing, Dr. Stupi?
No, I think this is really a great way of feeling better. They even use this for hangovers, as a matter of fact, with people who drink excessively and have a hangover. But it's a good way of repleting your system of the nutrients that will do a lot of benefit if they are on the low side, or even if normal, sometimes it will give you a boost. And so it's really something to consider. And I've become a strong proponent of this if it's administered properly.
Okay, and it is administered by our registered nurses who are healthcare professionals and do
IV infusion nurses.
Our other infusions. If you're interested in obtaining a Myers cocktail or a wellness infusion, you can dial the office at 724-935-9355 and hit the option for appointments. We do ask that you pay in advance when making the appointment, and then the infusion will be ordered and will arrive either the morning of or the afternoon of, depending on what time your appointment is. If you have any further questions, you can email us at info@ararc.net. Remember to subscribe to our YouTube channel and to tick the notifications, and you will be alerted when new videos are ready. Thank you again, Dr. Stupi.
Thank you. God bless all of you, and have a great day.
Everyone stay well and stay safe, and we'll see you very soon.